dry January takes on new meaning when the Santa Ana winds start to blow. Here to help you soothe your chapped skin, our friend Dr. Chaffoo. Good morning, and thank you for being here. Oh, I walk around with chapstick. My kids come home, their lips are red up to here. I mean, it's just so dry.
You know, you're absolutely right, Shally. The problem this time of the year is, as we've seen, of course, with these awful fires, the humidity level is very, very low. And like you were saying with the Santa Ana winds, the wind just whips by. And what happens to our skin, we know, as we've said before, it's the largest organ in our body. It regulates our temperature, protects us from outside structures, but it's also involved in water metabolism. And what happens is 60% of our body is made of water, if you can imagine that. So what happens is constantly, most water gets evaporated from our skin, from our pores. So in very, very dry weather, like we have now, where the moisture is very low and there's a lot of winds whipping by, you really see an effect where that moisture is wicked away quickly, and your skin can dry out much quicker than you would imagine it could, especially this time of the year compared to, say, the summer when there's more humidity in the air.
So take us through, what are some things that we can do for waking up and you just feel so crispy?
Sure, so the most important thing is hydration, and by that I mean not just hydration internally, but externally. We want moisturizers, especially in the winter months, to have more cream, more emollient, something that's going to stay around and stick and replenish the moisture that we have. Too often, and myself included, love those really hot showers. You know, if they're prolonged, again, it just dries out our skin even further. And then we crank the heat up in the wintertime because it's cold outside.
Right.
And if we keep it up too high, again, because the humidity is so low, it gets very, very hot, and there's more of what we call insensible water loss. So things you can do is obviously have a humidifier in your home, in your room, wherever you spend most of your time. That will replenish the moisture that we've lost. And always remember the moisturizers, and remember the sunscreens, like you and I have spoke about so many times before, because we're outside a lot now, especially the weather being so nice, and we think, well, it's the winter, I don't really need a sunscreen. No, you need a sunscreen the same all year, because it's all year here. We have that ultraviolet exposure, and it's a cumulative effect over time.
You talk about the moisturizers, and I notice this more in the winter than the summer. When you get out of the shower while your skin is still damp and wet, that's when I like press in a
it's the
really
perfect
rich.
time. Yes, because that's the time where you're right. You want to put that the first thing on your skin before you're applying anything else. And obviously, you know, a lot of moisturizers have built-in SPF. At least the American Academy of Dermatology says at least an SPF of 15 is the best to utilize.
You brought some products too?
And so the most important things, you know, like we talked about, were if you're going to use sunscreens more mineral-based versus chemically-based sunscreens. Don't forget lip balm, so important for our lips. Why is that?
Do you know what I rubbed last night? Avocado oil.
Yeah,
right from my kitchen.
Yeah, moisture. But you know what's nice about these lip balms is some of them have a sunscreen in it. And remember, lip cancer is a very common problem. You can't put sunscreen directly on the lips, so it's, you know, especially for the kids. You know, when they're outside, you want the SPF factors. You want some sort of a moisturizers, and if you're going to use any kind of cleansers at all, you want something that's again more of an emollient, it's more oil-based, if you will, versus water-based.
Well, this is all really good advice, and if this stuff doesn't help, then call the doctor.
Go see your, if you have a problem or a skin area that just isn't healing, it might be something more serious, get in to see a board-certified dermatologist and evaluate your skin.
Amazing. Thank you, Dr. Chaffoo.
Sure,
appreciate it. Always good to see you.